Hello, my name is Annette Usweta, and the country I chose to do my project on is Italy. Italy is located in South Europe. Italy is a peninsula that extends into the Mediterranean Sea. A lot of people know Italy as a country that's shaped like a boot. Italy has a population of 60,626,442 people. Italy's healthcare system is ranked second best in the world, according to the World Healthcare Organization. Italy provides universal healthcare to the whole population that is free or low cost to all residents. Italy has many private doctors and clinics that Italians use in addition to national health care services because they are usually quicker to get into. In 2011, Italy's under 5 mortality rate is about 4 deaths per 1,000 children, which is a really good ranking in comparison to other countries. In 1960, Italy's under 5 mortality rate was 52 deaths per 1,000 children. That number has decreased by 48 deaths in about 50 years. That is a big change, which is a really good thing. In 2011, Italy's infant mortality rates are about 3 deaths per 1,000 live births. In 1960, in Italy, infant mortality rates were at 44 per 1,000 live births. That number has decreased by 41 deaths in about 50 years. This is a very significant change. In 1960, Italy's total fertility rates were at 2, and most recently in 2010, they are at approximately 1. That hasn't been a significant change over the 50 years. The country that I compared to Italy's health status is Albania. Albania is a neighboring country to Italy. The graph on the top of the slide is Albania, and the graph on the bottom of the slide is Italy. These two graphs compare the total fertility rate, infant mortality rate per 1,000 live births, under 5 mortality rate per 1,000 live births, the female adult mortality rate, the male adult mortality rate, the female child mortality rate, the male child mortality rate, and the neonatal mortality rate. On the left side of the graph is the numbers from 2010, and on the right side of the graphs are the numbers from 2009. As you can see, there is a big difference in every category that is shown. These graphs are pretty interesting if you actually take a moment to look at them. The top health problems in Italy are the number one top health problem in Italy is circulatory disease. The second top health problem is cancer, which is mainly lung cancer, and the third top health problem is liver disease. Diseases of the circulatory system are the main cause of death in Italy. Men do have a higher risk of circulatory diseases than women do. So I was saying, lung cancer is the second highest health problem, and it is a huge problem in Italy because over 14 million people of their population do smoke. And when it comes to smoking, women actually outnumber the male smokers. And then the third top health problem in Italy is liver disease. And this is mainly due to how much alcohol the population there in Italy actually drinks. According to my research, I found out that about 90% of adults in Italy have at least one alcoholic drink per day. Italy is trying to do as much as it can to positively deal with their major health problems, and they make people aware of them so they don't become part of the statistics. Restaurants in Italy are all adding some healthier options to their menus, and nutrition classes are being offered for free in a lot of areas there in order to help people live a healthier life and to discourage circulatory disease. I believe this will definitely help in decreasing the numbers of people that are putting themselves at risk. In order to discourage smoking, a lot of public places, including restaurants, hotels, and bars, have put a ban on smoking, so people are not allowed to smoke in these places. Health officials believe that this can somehow discourage people to stop smoking completely. I would like to thank you all for I would like to thank you all for taking the time to watch my presentation.